Welcome to the third module of our Medicare Basics series, Medicare Prescription Drug Coverage, also known as Medicare Part D. My name is Benny, and I look forward to guiding you through this module. Before we get started, it's important that you have a quiet place to watch this presentation, you have something to take notes with, and you're ready to learn. In addition, it's important that you complete the first two modules of this series, Original Medicare and Medicare Advantage, as they build on each other. Medicare drug coverage helps pay for prescription drugs you need. Even if you don't take prescription drugs now, you should consider getting Medicare drug coverage. Medicare drug coverage is optional and is offered to everyone with Medicare. If you decide not to get it when you're first eligible, and you don't have other creditable prescription drug coverage, like drug coverage from an employer or union, or get extra help, you'll likely pay a late enrollment penalty if you join a plan later. Generally, you'll pay this penalty for as long as you have Medicare drug coverage. To get Medicare drug coverage, you must join a Medicare-approved plan that offers drug coverage. Each plan can vary in cost and specific drugs covered. There are two ways to get Medicare drug coverage. First, with Medicare drug plans. These plans add drug coverage to Original Medicare, some Medicare cost plans, some private fee-for-service plans, and medical savings account plans. You must have Part A and/or Part B to join a separate Medicare drug plan. Second, Medicare Advantage plans or other Medicare health plans with drug coverage. You get all of your Part A, Part B, and drug coverage through these plans. Remember, you must have Part A and Part B to join a Medicare Advantage plan, and not all of these plans offer drug coverage. In either case, you must live in the service area of the plan you want to join. Both types of plans are called Medicare drug coverage in this training. Now that we covered a high-level view, let's dive deeper into Medicare Part D. The prescription drug benefit is the part of Medicare that covers most outpatient prescription drugs. Part D is offered through private companies either as a standalone plan, for those enrolled in Original Medicare, or as a set of benefits included with your Medicare Advantage plan. Unless you have creditable drug coverage and will have a special enrollment period, you should enroll in Part D when you first get Medicare during your initial enrollment period. If you delay enrollment, you may face gaps in coverage and enrollment penalties. Each Part D plan has a list of covered drugs, called its formulary. If your drug is not on the formulary, you may have to request an exception, pay out of pocket, or file an appeal. Medicare Part D plans cover certain prescription drugs. The federal government sets guidelines for the types of drugs Part D plans must cover. A drug category is a group of drugs that treat the same symptoms or have similar effects on the body. All Part D plans must include at least 2 drugs from most categories and must cover all drugs available in the following categories: HIV and/or AIDS treatments, antidepressants, antipsychotic medications, anticonvulsive treatments for seizure disorders, immunosuppressant drugs, anti-cancer drugs unless covered by Part B. Some drugs are explicitly excluded from Medicare coverage by law, including drugs used to treat weight loss or gain, and over-the-counter drugs. Please note, for certain drugs or under specific circumstances, your drugs may be covered by Part A or Part B. You can join, switch, or drop a Medicare drug plan or a Medicare Advantage plan with drug coverage during the initial enrollment period. When you first become eligible for Medicare, you can join a plan. During open enrollment period from October 15th to December 7th each year, you can join, switch, or drop a plan. Your coverage will begin on January 1st as long as the plan gets your request by December 7th. During Medicare Advantage open enrollment period from January 1st to March 31st each year, if you're enrolled in a Medicare Advantage plan, you can switch to a different Medicare Advantage plan, or switch to Original Medicare and join a separate Medicare drug plan once during this time. If you have to pay a premium for Part A and enroll in Part B for the first time during the general enrollment period, you can also join a plan from April 1st to June 30th. Your coverage will begin on July 1st. Generally, you must stay enrolled in your plan for the entire year. But when certain events happen in your life, like if you move or lose other insurance coverage, you may qualify for a special enrollment period. You may be able to make changes to your plan mid-year if you qualify. You can switch to a new Medicare drug plan or Medicare Advantage plan with drug coverage simply by joining another plan during one of the times listed above. Your old drug coverage will end when your new drug coverage begins. You should get a letter from your new plan telling you when your coverage begins, so you don't need to cancel your old plan. There is an entire training module built around enrollment periods in the vault under Medicare Resources, along with many printable resources. Next, let's discuss creditable drug coverage, a term that you will want to get to know. Creditable drug coverage is on average as good as or better than the basic Part D benefit. You should receive a notice from your employer or plan around September of each year informing you if your drug coverage is creditable. Several types of plans offer creditable drug coverage, including Veterans Affairs benefits, TRICARE for life, federal employee health benefits, and some job-based and retiree plans. If you are considering delaying Part D enrollment because you already have prescription drug coverage, make sure to find out if your coverage is considered creditable. Maintaining enrollment in creditable drug coverage means you will not incur a late enrollment penalty for delaying Part D enrollment. Additionally, having creditable coverage means that if you learn that you are going to lose such coverage and you want Part D coverage, you will have a 2-month special enrollment period to enroll in a Part D plan. If you have no drug coverage or have drug coverage that is not creditable, Part D may help you. Even if you do not take prescription drugs, it is important to enroll in Part D so that if you later need to access prescriptions, you do not face penalties or gaps in coverage. Remember, if you decide to delay enrollment in any part of Medicare, keep a record of your insurance until you enroll in Medicare. You may need this documentation to sign up for Medicare later. There are certain kinds of drugs that are excluded from Medicare coverage by law. Medicare does not cover, for example, drugs used to treat anorexia, weight loss, or weight gain, with the exception of drugs used to treat physical wasting caused by AIDS, cancer, or other diseases, fertility drugs, drugs used for cosmetic purposes or hair growth, with the exception of drugs used for the treatment of psoriasis, acne, rosacea, or vitiligo are not considered cosmetic drugs and may be covered under Part D. Drugs that are only for the relief of cold or cough symptoms, drugs used to treat erectile dysfunction, prescription vitamins and minerals, except prenatal vitamins and fluoride preparations, non-prescription drugs also known as over-the-counter drugs. I would like to note that prescription drugs used for the aforementioned conditions may be covered if they are being prescribed to treat other conditions. For example, a medicine for the relief of cold symptoms may be covered by Part D if prescribed to treat something other than a cold, such as shortness of breath from severe asthma, if it is approved by the U.S. Food and Drug Administration, or FDA, for such treatment. Now let's discuss how to access Part D drug coverage. It's important to know the Part D plan's coverage rules when getting prescription drugs covered. This is the best way to avoid additional expenses and other issues. Before you go to the pharmacy, find out if your drug is on your plan's formulary. If possible, ask your doctor to check that your prescription is covered. Find out whether your plan places any restrictions on coverage, such as prior authorization where you must get prior approval from the plan before it will cover a specific drug. Step therapy where your plan requires you try a different or less expensive drug first. And quantity limits where your plan only covers a certain amount of a drug over a certain period of time, such as 30 pills per month. You always want to use a preferred, in-network pharmacy to fill your prescriptions. Many pharmacy networks include both preferred and non-preferred pharmacies. You typically pay less for your prescriptions at preferred pharmacies. If your drugs are not covered or are covered with high costs and/or restrictions, you have a few options. First, you can make an exception request, which is when you ask your plan to cover your drug as an exception to its rules. One specific kind of exception is a tiering exception, when you ask your plan to cover the drug at a lower cost. Note that in most cases you cannot use the exception process if your prescription is excluded from Medicare coverage by law. Next, you can ask your doctor if there is a drug on your plan's formulary that you can use instead, possibly a generic or another low-cost alternative. Next, if there are no comparable options on your plan's formulary, request an exception to your plan's rules. Ask your doctor to write a letter of support explaining why you need the drug and, if possible, how other medications to treat the same condition are dangerous or less effective for you. Then, if your plan does not grant the exception request, file an appeal. Finally, if you qualify, ask your pharmacist to give you a temporary supply of your prescription through your plan's transition refill policy. You can only do this if your drug was covered before you switched plans or before your plan changed its coverage rules. Remember, Part D doesn't cover drugs used for weight loss or gain, fertility, erectile dysfunctions, and cosmetics. It doesn't cover over-the-counter medication, vitamins, insulin, inpatient drugs, or drugs not listed on the formulary. So this means that there are some gaps in Part D coverage. So let's talk about how someone would fill those gaps. If you are enrolled in Part D and having trouble affording your prescriptions or finding plans that will cover your drugs, there are several ways you may be able to fill the gaps in your coverage. First, you can apply for extra help. This federal program helps pay for some to most of the out-of-pocket costs of Medicare prescription drug coverage. Next, you can check for state pharmaceutical assistance programs in your state. These programs help residents pay for prescription drugs. Each program works differently and not all states provide this option. Next, there is the option to keep your retiree drug coverage. Talk to you or your spouse's former employer to find out if your retiree drug coverage will fill gaps in Medicare's prescription drug benefit. Next, you can buy an enhanced Part D plan. Enhanced plans charge higher monthly premiums than basic plans but typically offer a wider range of benefits. For instance, these plans may not have a deductible, may provide extra coverage during the donut hole, and may have a broader formulary. Some of these plans may also cover excluded drugs. Keep in mind that benefits vary by plan. Finally, there is the option to join a Medicare Advantage plan that offers drug coverage with lower out-of-pocket costs. Medicare HMOs, PPOs, and other private health plans may offer drug coverage that lowers your upfront costs, such as the deductible. However, you will need to look at more than just the plan's drug coverage. Also make sure the plan covers your preferred doctors and hospitals at a cost you can afford. Keep in mind that after reaching catastrophic coverage, cost for your covered drugs will drop significantly. Okay, great. Now I would like to discuss transition drug refills. A transition refill, also known as a transition fill, is typically a one-time, 30-day supply of a drug that you were taking before switching to a different Part D plan, either standalone or through a Medicare Advantage plan or before your current plan changed its coverage at the start of a new calendar year. Transition refills let you get temporary coverage for drugs that are not on your plan's formulary or that have certain coverage restrictions, such as prior authorization or step therapy. Transition refills are not for new prescriptions. You can only get transition fills for drugs you were already taking before switching plans or before your existing plan changed its coverage. The following situations describe when you can get a transition refill if you do not live in a nursing home. There are different rules for transition refills for those living in nursing homes. First, your current plan is changing how it covers a Medicare-covered drug you've been taking. If your plan is taking your drug off its formulary or adding a coverage restriction for the next calendar year for reasons other than safety, the plan must either help you switch to a similar drug that is on your plan's formulary before January 1st or help you file an exception request before January 1st or give you a 30-day transition fill within the first 90 days of the new calendar year along with a notice about the new coverage policy. Second, your new plan does not cover a Medicare-covered drug you have been taking. If a drug you have been taking is not on your new plan's formulary, this plan must give you a 30-day transition refill within the first 90 days of your enrollment. It must also give you a notice explaining that your transition refill is temporary and informing you of your appeal rights. If a drug you have been taking is on your new plan's formulary but with a coverage restriction, this plan must give you a 30-day transition refill free from any restriction within the first 90 days of your enrollment. It must also give you a notice explaining that your transition refill is temporary and informing you of your appeal rights. In both above cases, if a drug you have been taking is not on your new plan's formulary, be sure to see whether there is a similar drug that is covered by your plan, check with your doctor about possible alternatives, and, if not, to file an exception request. If your request is denied, you have the right to appeal. Note, if you file an exception request and your plan does not process it by the end of your 90-day transition refill period, your plan must provide additional temporary refills until the exception is completed. Remember, all standalone Part D plans and Medicare Advantage plans that offer drug coverage must provide transition fills in the above cases. When you use your transition fill, your plan must send you a written notice within 3 business days. The notice will tell you that the supply was temporary and that you should either change to a covered drug or file an exception request with the plan. Next, let's review Part D coverage in nursing homes. If you live in a nursing home or another qualified institution, not an assisted living facility or a group home, and receive long-term care, you should be aware of how your prescription drug coverage may be affected. Specifically, different rules apply as to when you can switch plans and how you access drugs. Note, during a Part A covered nursing home stay, prescription drugs are covered by Part A, not Part D. The information below is only applicable to Part D coverage of drugs in a nursing home setting. Generally, nursing homes work with specific pharmacies, and you should choose a plan that works with your nursing home's pharmacy. If your plan does not work with your nursing home's pharmacy, because it is out of network or not preferred, you may end up paying higher costs for prescriptions. If you are in a nursing home, you are able to switch your drug coverage outside regular enrollment periods. Specifically, you can make plan changes. If your plan does not cover or denies coverage for a drug you need, you have the same right to appeal in a nursing home as you would if you lived elsewhere. While living in a nursing home, you also have these additional rights. If you live in a nursing home or are entering a nursing home from another setting, your plan must fill a 31-day emergency supply of your drugs outside your transition period while your exception request is being processed. If your request is denied, you have the right to appeal. Even if you cannot get your drugs covered, your nursing home should provide you with the drugs you need, though it may charge you for this service. You can change your drug plan outside regular enrollment periods. Moving right along, let's discuss the costs of Medicare drug coverage. Your drug costs will vary based on the plan you choose. Remember, plan coverage and cost can change each year. You may have to pay a premium, deductible, co-payments, or coinsurance throughout the year. Your actual drug coverage costs will vary depending on your prescriptions and whether they're on your plan's list of covered drugs or formulary. What tier the drug is in. Which drug benefit phase you're in, like whether you've met your deductible, or if you're in the catastrophic coverage phase. Which pharmacy you use, whether it offers preferred or standard cost sharing, is out of network, or is mail order. Your out-of-pocket drug costs may be less at a preferred pharmacy because it has agreed with your plan to charge less. And finally, whether you get extra help paying your drug coverage costs. I will go more in depth into each shortly, but first, let's discuss monthly premiums. Most drug plans charge a monthly fee that varies by plan. You pay this in addition to the Part B premium. If you're in a Medicare Advantage plan or a Medicare cost plan with drug coverage, the monthly premium may include an amount for drug coverage. If you have a higher income, you might pay more for your Medicare drug coverage. If your income is above a certain limit, $87,000 if you file individually or $174,000 if you're married and file jointly, you'll pay an extra amount in addition to your plan premium, sometimes called Part D IRMA. You'll also have to pay this extra amount if you're in a Medicare Advantage plan that includes drug coverage. This doesn't affect everyone, so most people won't have to pay an extra amount. If you have Part B and you have higher income, you may also have to pay an extra amount for your Part B premium, even if you don't have drug coverage. Usually, the extra amount will be deducted from your Social Security or Railroad Retirement Board payment. If Medicare or the RRB bills you for the extra amount instead of deducting it from your Social Security or RRB payment, then you must pay the extra amount to Medicare or the RRB, not your plan. If you don't pay the extra amount, you could lose your drug coverage. You may not be able to enroll in another plan right away, and you may have to pay a late enrollment penalty for as long as you have drug coverage. You'll pay Part D IRMA payments separately, even if your employer or another third party, like a retirement system, pays your plan premiums. Yearly deductibles are the amount you must pay before your plan begins to pay its share of your covered drugs. Some plans don't have a deductible. Copayments or coinsurance are the amounts you pay for your covered drugs after the deductible, if the plan is one. You pay your share and your plan pays its share for covered drugs. If you pay coinsurance, these amounts may vary throughout the year due to changes in the drug's total cost. The amount you pay will also depend on the tier level assigned to your drug. Once you and your plan spend $4,130 combined on drugs, including deductible, you'll pay no more than 25% of the cost for prescription drugs until your out-of-pocket spending is $6,550, under the standard drug benefit. Once your out-of-pocket spending reaches $6,550, you'll automatically get catastrophic coverage. You'll pay no more than 5% of the cost for covered drugs for the rest of the year. Note, if you get extra help, you won't have some of these costs. Medicare Part D, prescription drug coverage average national premium is $33.06. People with high incomes have a higher Part D premium. The Part D deductible varies by plan and cannot be more than $445 if you do not have extra help. For those with full extra help, the deductible is $0. For those with partial extra help, it's $8 to $9 or your plan's standard deductible, whichever is lower. Coinsurance or copays if you do not have extra help vary by plan and by drug within plan. In most plans, after spending usually $4,130 in total drug costs, you reach the coverage gap. During the coverage gap, you will have to pay 35% of the cost for most brand name drugs and 44% of the cost for generic drugs. In all plans, after spending $6,550 out of pocket, you will leave the coverage gap and reach catastrophic coverage. During this period, you will pay 5% of the cost for each of your drugs, or $3.70 for generics and $9.20 for brand name drugs, whichever is greater. If you do not have extra help, have Medicaid and or your income is below 100% of the federal poverty level, your coinsurance or copays will be $1.30 for generics and $4 for brand name drugs. After spending $7,653.75 in total drug costs, you will reach catastrophic coverage and pay $0 for each drug for the rest of the calendar year. If you have full extra help, you will pay $3.70 for generics and $9.20 for brand name drugs. If you have partial extra help, you will pay 15% of the cost for each prescription or your plan's standard coinsurance, whichever is lower. There are 4 payment stages for Medicare prescription drug plans. First, an annual deductible that ranges from $0 to $445. The member pays 100%. You pay for the cost of your drugs until you reach the plan deductible amount. Some plans do not have a deductible. If you do not, your payment starts with the first prescription you fill. Second, there is initial coverage of $4,130. The member pays 25%. The plan pays 75%. You pay a co-pay or co-insurance. The plan pays the rest. You stay in this stage until your total out-of-pocket costs reach this amount. Third is the coverage gap, also known as the donut hole. The member pays 25%. The plan pays 75%. You pay 25% of costs for name brand and generic drugs. You stay in this stage until your total out-of-pocket costs reach this amount. Finally, the last stage is the catastrophic stage. Once you pass $6,550, you pay $3.70 to $9.20 or 5%. The member pays 5%, the plan pays 15%, the government pays 80%. You pay a small co-insurance or co-pay for drugs. The greater of 5% of drug costs or $3.70 for generic, $9.20 for brand name. You stay in this stage. Next, the Medicare drug coverage, Part D, late enrollment penalty. The late enrollment penalty is an amount that's permanently added to your Medicare drug coverage, Part D, premium. You may owe a late enrollment penalty if, at any time after your initial enrollment period is over, there's a period of 63 or more days in a row when you don't have Medicare drug coverage or other creditable prescription drug coverage. You'll generally have to pay the penalty for as long as you have Medicare drug coverage. Note, if you get extra help, you don't pay a late enrollment penalty. There are 3 ways to avoid paying a penalty. First, enroll in Medicare drug coverage when you're first eligible. Even if you don't take drugs now, you should consider joining a Medicare drug plan or a Medicare Advantage plan with drug coverage to avoid a penalty. You may be able to find a plan that meets your needs with little to no monthly premiums. Second, enroll in Medicare drug coverage if you lose other creditable coverage. Creditable prescription drug coverage could include drug coverage from a current or former employer or union, TRICARE, Indian Health Service, the Department of Veterans Affairs, or individual health insurance coverage. Your plan must tell you each year if your non-Medicare drug coverage is creditable coverage. So, how much more will you pay for a late enrollment penalty? The cost of the late enrollment penalty depends on how long you didn't have creditable prescription drug coverage. Currently, the late enrollment penalty is calculated by multiplying 1% of the national base beneficiary premium. The final amount is rounded to the nearest 10 cents and added to your monthly, $33.06, by the number of full, uncovered months that you were eligible but didn't enroll in Medicare drug coverage and went without other creditable prescription drug coverage premium. Since the national base beneficiary premium may increase each year, the penalty amount may also increase each year. After you enroll in Medicare drug coverage, the plan will tell you if you owe a penalty and what your premium will be. Here is an example. Mrs. Martinez is currently eligible for Medicare, and her initial enrollment period ended on May 31, 2017. She doesn't have prescription drug coverage from any other source. She didn't join by May 31, 2017, and instead joined during the open enrollment period that ended December 7, 2019. Her drug coverage was effective January 1, 2020. So in 2020, since Mrs. Martinez was without creditable prescription drug coverage from June 2017 to December 2019, her penalty in 2020 was 31%, 1% for each of the 31 months, of $32.74, the national base beneficiary premium for 2020, or $10.15. Since the monthly penalty is always rounded to the nearest 10 cents, she paid $10.20 each month in addition to her plan's monthly premium. In 2021, Medicare recalculated Mrs. Martinez's penalty using the 2021 base beneficiary premium, $33.06. So, Mrs. Martinez's new monthly penalty in 2021 is 31% of $33.06, or $10.25 each month. Since the monthly penalty is always rounded to the nearest 10 cents, she pays $10.30 each month in addition to her plan's monthly premium. Alright. This concludes our Medicare prescription drug coverage or Medicare Part D training module. The next module in the Medicare Basics series is Medicare Supplements or Medigap. If you need additional help, make sure that you reach out to the training department and/or a manager. Thank you for the pleasure of your time. I look forward to seeing you in the next module. Have a great day.